Hello, my name's Kerry and I'm a new PhD student at UCL funded by the Stroke Association. My research continues the UTILISE project led by my supervisor, Professor Rosemary Varley. UTILISE is a sentence level therapy for people with aphasia or language difficulties after stroke. There's been a lot of research on single word therapies for people with aphasia, such as naming pictures, but much less on sentence level therapies. This is a problem because people with aphasia listen to and want to speak in everyday conversations, where we speak in sentences, not single words. UTILISE aims to improve both understanding and the saying the sentences we use most often in everyday conversation. UTILISE is being made into a computer app, and this is where my research comes in. I worked in the NHS as a speech and language therapist with people affected by stroke, immediately after stroke, in early intensive rehab, and in longer term recovery. And I saw how these services changed during COVID, so there was less and less one-to-one speech and language therapy available. Apps are set to be an important tool in stroke recovery to help people with aphasia get the high-dose therapy they need to improve. However, there's limited research about them, so when my previous patients asked me about apps, I often had to say, we don't know yet. My research aims to help change that answer by giving a range of information about UTILISE therapy. This includes, do people improve after using the app? Information about the effective dose or how often and how much someone used the app, and what people with aphasia who've actually tried it think of the app, and whether therapy changed everyday conversations between people with aphasia and their families. This information is important to help people with aphasia, their families, and speech and language therapists identify better forms of therapy, and is useful information in designing future stroke recovery apps. Thank you so much to Stroke Association donors for making this research possible as a step in improving the lives of people affected by stroke.